Hey, my name's Spencer Wable, and I wanted to go over this with you so that you had an idea of what makes us different from other offices. We do have a lot of people that go to multiple consultations, and they'll go to Nuvia, Clear Choice, Stubbs, University of Utah. Some people go to 5 or 6 places before they come here. Some places come here and then go 5 to 6 places. There's a lot of people that can do this, but I just wanted to go over today what makes Sundance Implant different. And I'm just going to be going over exactly what's on our website. There's probably 30 different points, so I just want to go through each one of them and give you an idea of what makes us different and special compared to other offices. There's plenty of places that can do this. We're not the only place that does it, but we do offer a lot of value for what we do, and we're reasonably priced compared to most places in Utah and a lot of places in the country. The first thing that makes us really different is that Dr. Nicholson is a board certified periodontist, and we also have a certified prosthodontist named Dr. Clemens right now. And what we do for your case is we make it custom to you, and we can handle almost any case. There's only been one person I've ever seen him turn away. A lot of places, if you have extensive bone loss, or if you have problems where the nerves are too close or they can't put the implants in at the right angle, they will just send you away to a periodontist that is specialized in doing those kinds of cases. I have only ever seen him do that once, and it was because the other doctor had done a lot of work that needed to be finished, and it just didn't make sense to have two of us doing it at the same time. A specialist, basically, he's really knowledgeable in creative ways of putting in the implants, and he can do zygomatic cases where if it can't just go right into the teeth or right up into the bone to secure the teeth, he is specialized to go up into the cheekbone, where if you've had dentures for a long time and there's nothing to really fit the dentures on anymore and you can only do fixed options, he can do these zygomatic implants that go up into your cheekbone, and the recovery is slightly longer, maybe a day or two longer, and it'll be sensitive, but he's able to make sure that people have these teeth. And on the bottom, if there's severe bone loss, where if the jaw is deteriorated from this with a set of full teeth and we're down to here and the implants aren't really fitting in anywhere else in the bone, he's able to put implants down there, and he can do pretty much anything from one tooth to a full mouth. But a lot of places will just say, hey, we can do this block, that's it. If you can't do that, then you got to go somewhere else. We can do pretty much anything under the sun as far as implants go and full mouth restoration. So that makes us pretty different. Also, compared to other places, the surgery is usually known as an all-on-4. Sometimes you'll see a 3-on-6, but all-on-4 just means we're going to put all of your teeth on 4 implants. Dr. Nicholson over-engineers these to last. So this is a block where we were able to put 6 implants in, and it's not going to change the cost whether you do 4, 6, 8, it doesn't matter. He will put in as many implants as your bone can support. So in this guy's case, we were able to put 6 implants in his zirconia, and we do it custom to the patient. So we make sure that the implants go in just like they're supposed to. We don't just have a cookie cutter where we say, okay, we're putting in 4 and that's all you get. A lot of times we are also able to do it faster than other offices because I'm here and we have assistants that can do a lot of the records and do probably 90% of the consultation getting you ready to see Dr. Nicholson. And so a lot of times, even if he has a packed day, he can pop in and tell us exactly what we need to know, and then I can go over the rest with you. There are some offices, my friend just texted me last week and said he couldn't get in for an implant until 6 weeks out, 8 weeks out, and depending on what he said, and he didn't even know what he needed done. There's a lot of times where I'll text people and I'll say, hey, I've got times Monday through Thursday, 10 a.m., 2 p.m., 12 p.m., just whatever you can come in and do. And I can see people same day. And last week we had a case where we saw her Thursday, got her records done Friday. And just because of how her schedule works, we're actually doing her surgery at the end of the month. So August 8th, she comes in and sees us, and she could have had it done by the 15th, but she had her own scheduling things. And we can actually do her surgery on August 29th. And so there are a lot of places that you're 8 to 9 months out before you can get the surgery done, whereas we here can get the surgery done within 2 to 4 weeks usually, and typically the delays in the surgery are on the side of the patient. So it's usually not from our schedule, it's from the patient deciding how they're going to move their finances, what times they have for to come in and get the surgery, recover. There's just a lot of things on the patient side, but on our side, we can get people doing this very quickly, whereas other practices might be 2 to 4 months out to even see you, and then 6 to 8 months out before they even start the surgery. So we're able to get a lot done in a short amount of time. And again, on the implants, if your bone can support more, we're going to put in a lot more implants to make sure it's built to last. Other places will do 4 and they say that's it, you're going to have to pay if you want any more. Dr. Nicholson doesn't like that, and it's a set price, and you can receive anywhere from 4 to 8 implants on either jaw, depending on where it's at. Typically, there's, most people who are in this stage can support 6 implants up top and 5 below. Your case, you might only be able to do 3 to 4 on the bottom if you've had substantial bone loss, but we can do something. We can get a really great restoration no matter where you're at in almost like virtually all cases. And he's a certified specialist and able to do that, whereas a lot of other places are just like, look, we're trained to do this, that's it. Him being a specialist too, I mean, there's a lot of places that will say, hey, we can do this for 9 to 10 grand, and then you find out that it's a kid my age or younger, I'm 28, and you find out they're doing it and they've never done a full arch surgery, or they've done 2 or 3 before. They're not going to do anything custom to you. And it's just like it's a really risky restoration, where they're not having somebody trained that comes in and does this. They can do it cheaper because they're not as experienced, and you'll likely have problems going forward. Another thing that a lot of people mention is really different is we have a really boutique feel, where it's custom to you. A lot of places have just kind of a cookie cutter dentist office, and here everything's modern. We have a really nice setup where we have glass barn doors everywhere, and we really try to make it not smell like a dental office. That's actually one of the reasons I worked here, is because it didn't feel like a dental office. Now, of course, there's everything you need to do dental surgery, but just the layout and look of the office, I felt like it was much more open. I wasn't as nervous about it. It felt cleaner, and that's just something that really helps with patients being comfortable and not having dental anxiety. And with the implants that we do put in, we make sure that they're only the top of the line Straumann implants, which are the most compatible OEM parts in the world. We make sure that we don't use any knockoff brands, and that's something that some place might say, hey, we can do it for 10 grand cheaper than Sundance or something like that. I mean, that's very, very rare, because most of these things are priced at about the same price point. But the way they can do that is they're using cheaper implants, or they're using a surgeon that's not as skilled, or they're skimping on aftercare. And I'll talk about that in a minute, but the reason that it can be cheaper sometimes, if you're like, hey, it's the same thing, it's like, it's not the same thing. It's not the same thing to use knockoff parts, to have a surgeon that's not skilled, and to not give you any aftercare, or to charge you, it's like, hey, it's 10 grand cheaper, but we're not going to do anything after the surgery. We're just going to put your teeth in, and if something happens, good luck. Whereas we bundle it all together. We're making sure that we're taking care of you 3 to 4 months out, and then we're taking care of you for 2 to 5 years after that, covered under warranty, making sure that everything goes according to plan. And making sure that the parts are compatible. I mean, we had somebody who went and got it cheaper in Tennessee, and then came to us, and we didn't have compatible parts because they used a knockoff implant, and the restoration didn't look great, but we also couldn't tighten it once she moved. Whereas when you're using OEM standard Straumann parts, which are the most popular and the best implants in the world right now, you're able to have more compatibility with dentists if you ever moved, or if Dr. Nicholson retired or wasn't able to practice anymore, you would be able to go on and you're like, hey, I've got the best implants, they're all standard, here's my records, and you're able to go and get care elsewhere if anything should happen. And we make sure that all of that can be done really quick with the prosthodontist as well. Like, we get your teeth in, we get the implants in, and we make sure that you have a prosthodontist that takes care of them, and they're high quality temporaries. Some other places give you temporaries that'll chip or crack within a few months, and then they'll tell you you're 6 to 8 weeks out. We had one lady who went to Clear Choice, and she chipped one of her teeth, and it took her, I think it was 6 weeks before they could get her a new block. Whereas here, if you chip it, we can get it to you, I mean, max probably 5 days, but most of the time it's same day or the next day. Like if you broke it Tuesday night eating some like crackers or something, we could get it reprinted for you and secured back within a day or two typically. It just depends on your time frame and what our availability is, but we have all of the software here in-house to make the teeth and get them back to you. So those temporaries are a lot higher quality, and if anything happens to them, we're able to replace it very quickly. And we could go through multiple temporaries. So if if you're chipping and cracking this and you're not really getting you're not really understanding it, or just being like, oh, I broke it, I didn't understand, I couldn't eat that, we're able to replace that really quick, and that's all included in the price, whereas other places might charge you $1 to $2 grand to reprint that prosthetic. Of course, if you're going overboard and we're printing a ton of them, then we need to have a different conversation, but usually we're able to get it done really fast, and there's multiple temporaries that are included in that. The in-house lab is really good for not only the custom work, but just the quality. We have a Zircon, which is an Italian mill, and we use zirconia from Italy. And this is the top of the line stuff. We're not like other places that might use a knockoff material or call it something else. To save some money on printing it, we only use the best top of the line stuff for zirconia products, and our digital workflow makes it so we can do this really fast. Some places still do the goop bites, and you're going in there checking your bite, checking your teeth for 6 to 8 weeks sometimes, but we have a completely digital scan where we can get everything done. Last week, that lady that came in on Thursday, we had her come back the next day for records, Friday, and we could have done her surgery Thursday and been done with her teeth. Some places are going to be like, hey, come in and get the goop bite. We need you here once a week for the next 8 weeks to get your records done. We don't have very much time to see you. And then after we get all those done, you're going to wait a month and get the surgery. So we can do these things within a week if you're ready to do it. And if you need some more time, basically every week or two, we have a slot where we could do this for you and make sure that it's done, and we have the facial scans and get the designs back and make everything in-house, so we can get it done very, very fast, but using quality parts, using a quality doctor to make sure that it's done right. The sedation that we offer, a lot of places might give you 2 pills and a couple pills for twilight sedation, and then you take that and you're kind of coming in and out of it, wake it up while you're in the surgery, or they'll just numb you and they're doing it and you're sitting there with your mouth open for 3 to 5 hours. And that's not how we like to do it. It is an option if you want to save money on anesthesia, you can, but it's standard practice to include anesthesia in all of our final costs. You're not paying them separately like some other practices do. When doc says a price, that includes anesthesia, and it's a hospital-based anesthesiologist who has 25 years experience. His name's Tony. One guy comes in, does all the anesthesia for you, and you're out the whole time, and it gives Dr. Nicholson time to focus on your case rather than some of these other dentists or specialists who might be trying to monitor the anesthesia at the same time they're doing the surgery, which causes more risk for doing the surgery. So you might have a doctor that's making more mistakes if they're trying to finagle with the anesthesia at the same time. We do have a lot of in-house financing options. I mean, I look at a lot of places in Salt Lake that say, hey, you're going to either borrow from your 401k or come in here with cash and that's it. My whole job as a finance specialist is to help you fix your credit. We're going to help you look at all these different financing options. We're going to talk about HELOCs. We can talk about borrowing against a car or an asset, and I'm here for the long run. I mean, I've helped people over a period of 6 months to get this done, whereas other offices will text you, hey, you got the money yet? Hey, you find the cash yet? Hey, did you get the time to do it? Dr. Nicholson is always trying to find new vendors and new ways to help people finance this, and does have in-house options, which I've been told are not really available anywhere in the US, and I've never found another office that would offer in-house financing for any portion of it. They want you to come in with the cash. So that's another thing that we do that's really a difference maker for people. We also do extra bone grafts, where we had one guy who only wanted to do an upper denture and then a zirconia bottom, and he was having issues with his bone up top, and he said, look, I don't want that right now. Well, Dr. Nicholson included a bone graft up top to make sure that he was ready to get implants in the future if he did want them, so we didn't have any more bone loss. Another good thing we have is one central location. A lot of offices, they might have you go to a consultation here, then go get the surgery, then come here for the prosthetic, whereas at Sundance, everything is done here. You come in, you get the consultation right here, the surgery's done in the room back there, and you're able to get everything done in one location. And same thing, the teeth are made here. The only thing we're really outsourcing is, we order the implants and they come to the office. You don't have to go anywhere but here. But then the other thing is like getting the designs back from a CAD designer to make sure it fits your face with all the digital impressions. But we do the printing here, we do the fitting here, everything is done here at this office. And we also have a 5-year warranty on what we offer. Some places just say, hey, good luck. I've seen them a lot of times reprint it for people who broke it out or had some issues with it and redesigned it. And we make sure that everybody has a pain protocol. We make sure that everybody is anesthetized and that there's no hidden fees. We want to have a block package for you and there's no surprises. Other places might be like, yeah, it's 30 grand. And then, you go through the process, you get the surgery and they go, oh, well, aftercare is 20 grand. And you're like, what happened? I thought this was all included. So here we want to make sure that the pricing doesn't change. He honors pricing if you came in and it's been a couple months within reason, like it's case by case, of course, but I've seen him honor pricing from a couple months back because people had some issues getting in. And we make sure that we work with you. I mean, some people might take you a year before you get it done, and I'm here to help you during that time, and he's here, and he's on call for a lot of different things, and we make sure that your doctors know what's going on, your family, if that's part of it, we can talk to your family members and go through it. So a lot of offices will just be like, hey, can you do it? No? Okay, call me when you can, you figure it out. Whereas here at Sundance, we want to make sure that we help you figure it out if that's what you need. Now, if you're just like, hey, I'm going to call you in 6 months, don't bother me, I'm totally fine to do that. If you're like, I need help every 2 weeks trying to get this together, I'm also here to do that. I have a master's of business administration. I worked in finance for years. I'm very familiar with taking out loans, 401k options, investing, repayment of terms. I've gotten a lot of experience in this area, whereas some other treatment coordinators at other offices are nervous to talk about the money. They're nervous to go over all the options. They just say, hey, it's 40 grand. When can you do it? When can you come in? And they don't really talk you through everything. Whereas here, we want you to make sure that you're very well educated with the process. All of these points I've gone over are just on our website at Sundance Implant on the All-on-4 surgery. Now we call it that on the site just because that's what most people understand it as. But All-on-X is we put it on as many implants as your jaw can support. And if you have any questions for us, you can go through that page and kind of go through, okay, what do you mean by OEM? What do you mean by this pain protocol? What do you mean by the Italian mill? Tell me why it's different and re-explain it to me, and I'm here to do that. And all of this is listed on the site where it's like, this is what we do differently versus this is what other offices do. So if you have any questions, feel free to reach out to me or Dr. Nicholson, and our number is on the site where you can give us a call anytime. I appreciate you letting me go over this with you and kind of review what makes us different, and I hope we can see you soon. Thanks. Bye.